to break room closures, you mentioned that there are some circumstances that won't necessarily be feasible. For example, firefighters. Can you go into what this won't cover?
Yeah. So there are some instances, for instance, companies that do a lot of contracting with the federal government, they have to comply with the federal government's regulations. Sometimes there are in-union contracts, certain provisions. So I'm not suggesting to companies that they break contracts or violate regulations. In those instances, you have to find another creative way. In those instances, we would ask you to go to reopeningri.com and look at ways you can adjust the break room without closing it. Maybe you can have a sign-up system so there's only one person in there at a time. Make certain that everybody who's in there has a mask on. Keep the windows open and have a sign-up system. Only allow folks to, keep their food in there. So anyway, we don't want anyone to break rules, break contracts, get into trouble with their customers if it's the federal government. If you can, close them. If you can't, get creative. Put a tent outside, put a picnic table outside. Encourage folks to go for a walk.
Governor, I'm sorry if I can follow up. In that instance, you mentioned allowing one person in, only. Does that apply to all break rooms or just in those circumstances?
We want break rooms to be closed, but if you can't, for whatever reason, then keep them open, but make accommodations like only one person at a time, a sign up, make sure everyone's wearing a mask, open the windows if you can. Like some things we're doing, remove the tables and chairs. Remove half of the tables and chairs. Like, the problem is when you have like 6 or 7 people in a small break room all at once hanging around with people you work with without your mask on drinking coffee for half an hour. That's a problem. So we can't let that happen.
Governor, I think a lot of people are asking, what was it that took an additional 24 hours to roll this out? Was it the Monday holiday? Is this a lot of this key to what you were told by Dr. Deborah Birx last week?
Yes.
Why the delay here?
Yeah, a few things. You want to get it right. I'm asking people to do things that are disruptive, so you want to make sure that it's warranted. We wanted to go through the data one more time. I'm trying to get to a place where we do targeted interventions. I don't want to go to the close the whole economy, close all retail, stay-at-home order. So we're really trying to sift through it to say, okay, if break rooms are the problem, focus on the break rooms. So we just, we wanted to take our time to get it right. The Dr. Birx visit was really eye-opening, I can say, for both of us. We had the benefit to sit with her, and she took us through state after state after state in their experience, and so, we listened.
That was her message, right?
That was her message. She came here to see our universities, but I think she really came here to tell us, guys, I see warning signs in this data that I've seen in other states, so heed the message and make some changes.
On Halloween, the big thing you said was try to go out during the day. Most kids, my own included, want to wait till it's dark out.
I know.
You said it's harder to control, but if you're going out in a small group, like just you and your parents and maybe a friend or two, why shouldn't they be able to go out at night? You said harder to control.
Yeah. So it's harder to get people, I know from experience as a governor and a mother, it's harder to get people to follow rules over a longer period of time. So, if you start trick-or-treating at 5 and you're still trick-or-treating at 8, human nature is you're going to stop following the rules over time. It's harder for us, actually, to kind of be out and about and see what's going on. So what I would say to you is we are not going to be in the business of finding children for being out in their little costumes. But I'm asking you as a parent, try to encourage your kids that this is a different year and get them at home by dark.
Just to follow up, apart from the break room order, everything you're saying here today is asking. Do you feel, I'm asking you to do this?
Regulations or new regulation. She's putting out the Department of Health is putting out new regulations today. State Police is tripling its force over the Halloween weekend. DBR is going to start getting a lot more serious about imposing fines and the break room. those are the kind of concrete changes in regulation and enforcement. Beyond that, you're right. And that's why I was saying in the beginning, I'm out of levers. The stuff that's happening that's getting us in trouble is happening in people's homes, cars, backyards, basketball courts, playgrounds. That's hard to regulate with enforcement. So, yeah, you're right. I'm just asking people to do the right thing so we can save the lives of Rhode Islanders.
Governor, for what we know about the virus, could someone that has COVID, could they spread it by giving out candy?
I'm turning that over to you.
Or whatever treat they may give out?
It is why we have given specific recommendations in the guidance that we want people to go to for Halloween on reopeningri.com. If someone has COVID, puts their hand all over, candy, puts it in a bowl, mixes it up, and has a number of other people come within a few minutes, within the hour, to touch the candy, touch the bowl, touch other things, yes, COVID can spread. COVID does live on objects and can spread, particularly if people are not wearing masks. So the first key is making sure everyone has a mask on. It's not just the cover of the costume, but an actual mask to prevent spread. Making sure that we're doing it in the daylight so that by dark, the number of people who are still out there doing it has decreased. And those who are setting the candy out, keep their doors closed, place it on a tray or place it open, individually wrapped, so that someone can just pick it and go. In those situations, the risk of transmitting COVID is significantly decreased.
And what about parents when they get home? Should they wipe off the candy or other treats that the children get?
They are certainly welcome to.
Should compromised people be even interacting on Halloween? I mean, is that even worth it at this point if someone is older and compromised?
It is not worth it. It is not. If someone's older or has underlying illnesses, going to parties, engaging in Halloween, doing other things that place you at risk, this is not the time to do it. It's also why it's so critical that everyone wears a mask, because if you feel fine and you're healthy, but you are exposed to someone who just has to be out there or has to come to your house, you wearing a mask can help protect that individual. That's why this message is about looking at your interactions differently in your own home. When someone comes to visit who's an older age or has some underlying illness, place a mask on while you're in the house together. Open the windows. Make sure that there's a distance in place. These are steps we can take to save lives.
Doctor, thinking back to the spring, one of the big issues was the availability of PPE, and specifically with respect to N95 and high-grade masks. What is the status quo in terms of both the retail sector and the state's supply of N95 or higher grade masks that can be distributed to folks who are frontline workers, or particularly those people who are most vulnerable, whether they're in congregate care settings? In other words, do we have the sufficient PPE for the general public now, and is that one of the major differences between now and the spring?
So with a huge credit to our PPE team that has been working through this entire time, the medical grade PPE, masks, and otherwise for our frontline healthcare workers is in an adequate supply. There's always more that can be obtained, but we don't have scenarios where people have run out right now. I would not say that regular members of the public should go and get the medical grade supply, because particularly with numbers increasing, we need to make sure that the medical grade supply of personal protective equipment continues to be available for our frontline healthcare workers. I do want to make sure that everyone has access to any kind of cloth face covering, and that everyone understands how critical wearing a mask is, outdoors, indoors, in the public. in our personal settings. You do not need a medical grade version to do that. We do have enough for our healthcare workers, but we have to keep it that way. And the more we can keep people out of the hospitals because they're wearing their masks now, the better off we can be altogether.
But is it fair to say for an immune-compromised person that if they can get their hands on an N95 mask, I remember back in the spring, this conversation was, maybe that's not a responsible thing to do, that equipment should be given to, I remember dentists giving away their personal protective equipment to frontline healthcare workers. Where are we at now just in terms of inventory? So if you're immune compromised and you have to wear a mask, can you morally acquire an N95 mask?
Our preference is to still make sure that the healthcare workers have the N95 masks, knowing that if everyone wears masks in the normal setting, whether you are immune compromised or not, you can be protected.
Thank you. Doctor, on the topic of holidays, families are going to gather for Thanksgiving dinner, Christmas dinner. Aside from mask wearing, can you share just some general tips? Should families be temp checking at the table, getting tested before going to a relative's house? Can you just share some general practices?
Yes, so for holidays, any kind of gatherings, the number one message that overrides any step you take is to wear a mask. Number one message in those gatherings with family members, loved ones. Additional steps, because we appreciate having layers, are definitely keeping your distance, definitely washing your hands regularly, and if you do go to an event where family has come together, and people have done those things, but you're still concerned, going to get tested is something that we have in place. We're building capacity to do so that people are able to keep track and increase the number of folks without symptoms who get tested. The number one focus, though, is making sure that you're wearing a mask in those settings, particularly through the holidays. We want people to be able to enjoy each other. This is the way to do that safely.
Governor, I have two questions. You talk about testing. Who's paying for the testing? What kind of tests? Are you hoping that the federal government helps out? Where do you, are you going to do PCR? Going to do spit tests? What kind of tests?
Yeah, okay. So right now we're paying for the testing using our COVID stimulus money. We have allocated more than $100 million for testing. We are employing some PCR test, some rapid test. We just started receiving for free from the federal government the Binax Now tests. So we are probably going to be using those more on colleges and universities, K through 12. So right now we have it divided into, there's our K through 12 system. So if you get sick or you feel sick in school, you'd go to the K through 12 system. They're using an antigen test and also a PCR as a backup. So that's K through 12. We have the portal that I'm really pushing today. That's for asymptomatic, that's for people who feel fine. The waiter, the waitress, the hairdresser feels great. I'd like you to go get a test. We're doing that mostly at the convention center, mostly PCR tests. And this is all, insurance will not cover testing for asymptomatics. So we are using our COVID money to pay for that. Most insurance will cover a test if you're sick. So if your insurance does cover it, then we'll charge insurance. But the bottom line is no one should worry about paying for it. We're going to spend well over $100 million of our COVID money to have testing everywhere. We haven't yet, we're not yet, these are all nasal swabs. The good news is if you were tested months ago, it was a pretty invasive swab. We've gotten away from that, and it's a gentler nasal swab. We haven't yet started using saliva, but we're working on it. We're working on it, and we hope to get one approved that we can use.
And then on the second question, I have a follow-up question. Yesterday you talked about Governor Whitmer and sort of the plot to kidnap her. Have you talked to her? And more importantly, have you gotten any threats from the FBI that you've been briefed on from the state police about trying to kidnap you or kill you based on your COVID restrictions?
So I'm not going to talk about my own personal security, except to say that I have a detail, top-notch. I feel very secure, and I feel very safe in the hands of the Rhode Island State Police. I did call Governor Whitmer. She's a friend. I think she's a terrific governor. I talked to her a couple times. You know, she's a strong woman, and she has good security, but I think she feels, as I do, that there's no place for violence. There's no place for threats. You can disagree with her. People here have questioned my authority to use our stay-at-home order. It's fine to disagree. It is not okay. By the way, that's for everybody. You know, you're seeing an increase in violence across the country. Not okay. And so she's fine. She's holding firm, and she's doing just fine.
Are you worried about that coming up to the election in Rhode Island, the increase in violence?
Yes, I am. We're preparing for it. We are preparing for it. I hope it doesn't happen. I hope there's a smooth election. Everybody should vote. But we are putting security contingency plans in place because I think it's a possibility.
Thank you. Governor, two brief questions. Do you think this is the start of a second wave?
I'll answer it, and I'll let the doctor answer it. I hope not. It's in our control, Anita. That's the bottom line. Like, I would say this could easily become that. So if we don't adjust our behavior, if we say, oh, the rules don't apply to me and my family, then yeah, it'll be the start of a second wave. No doubt about it. But we're ahead of it now. We're ahead of it now. We're not there yet. We have a test positive of 1.9. So if everybody does what we're asking them to do, then no, I don't think so. I think a month from now we'll be coming back down the curve. She agrees.
Switching gears a little bit to your comments you said yesterday regarding Pawtucket. The Pawtucket Teachers Alliance is calling your comments yesterday a reprehensible mischaracterization of the school department. They're asking for an apology. What's your response?
I don't agree with that. So what I said was that they are shortchanging the kids by not being in school. That's a fact. I'll just tell you the facts, Anita, and people can make their own decisions. The only kids in Pawtucket who are in school are pre-K and K, not first grade. That comment you read, they said that the littlest learners are in school. Last time I checked, a first grader was a little learner. They're not in school. First grade not in school, second grade not in school, third grade not in school, fourth grade not in school. Those are all little learners at home struggling because the adults aren't working hard enough, being creative enough to give those kids a chance. So I stand by my comments. Secondly, they pointed out that Pawtucket has more than 100 cases per 100,000. I accept that. So do hybrid. Do what Providence is doing. In Providence, which is also above the threshold, all pre-K through 5 kids are in school. But middle school and high school are hybrid. So do that. In fact, that's exactly what I said yesterday. Central Falls, Providence, do a hybrid for older kids. But to simply say, we can't do it, I don't think it's right. I don't think it's fact-based, science-based, and I think it's hurting the kids. So I will stand by my comments and ask them to give us a call and let them help them get these kids back in school.
Governor Raimondo, you and I spoke yesterday about purgatory, this sort of miasma that Rhode Island businesses, really businesses around the nation, find themselves in with this steady drumbeat of bad news and financial pressure. And let's be honest, we also live in a society where most pandemics are cured in under an hour and a half on TV and in the movies. We know that not to be true now. But at the same time, if I can unearth another 1970s era model, was managing by objective. I think we all remember that in freshman year of college. At this point in time, given this...
college in the 70s, but I'll go with this.
Okay. So, but given, again, this steady, realistic yet drumbeat of bad news, is there an opportunity at this point in time to put up some bogeys, as we used to say, some objectives, where if we meet this, then if X happens, then Y restriction is lifted or modified? If their businesses are looking for a silver lining.
Yeah, I think that is an excellent point, and the answer is yes. And once I get through this week and this messaging, I'm going to start to get to the business of doing that. So look, this is really hard, and people are fatigued, and businesses are barely getting by, and people are wondering, when is this going to end? But here's the good news. It isn't forever. It's not. Even before we have a vaccine, I think we can start releasing restrictions, and there will be a vaccine in a matter of months, not years, and then we can go back to a sense of normalcy. So I can tell you there's light at the end of the tunnel. But already we're also thinking of ways that we can help businesses regain business next year. For example, I think that mayors and we, the state, should, we've relaxed a lot of regulations, allowing dining outside, allowing dining on sidewalks. I think we need to take a hard look at all those regulations and allow them to continue to be relaxed so that when they can reopen, they can make up for some of the lost business this year. So I don't have any specific announcements right now, except to say that I like that way of thinking, and we are going to start moving in that direction.
Governor, on Thanksgiving, you said stay local. How local are we talking? Should you go to Massachusetts? If you live in Providence, should you go all the way down to Westerly to see your cousins? And also, if you're supposed to wear a mask at Thanksgiving, how is that going to be practical when a typical Thanksgiving dinner, 10 to 12 people around a table eating? What's that going to look like? Are you worried about that?
So, at some point, we all have to use our judgment. So, I'd like you to stay off a plane. I'd like you to stay off a train. I'd like you to stay as local as possible. I'd like you to keep your family or friend gathering, however you celebrate, as small as possible. You know, it's not the year to have all your aunts and uncles over and have 25 people. Maybe it's a different tradition, just your family, or just your family and a couple close relatives. Keep the windows open. Maybe if grandma is older, maybe grandma has to stay in another room. Obviously, you have to take your mask off to eat and drink, but think about not sharing utensils, not sharing a big family-style bowl. So, look, we have to live, and we have to have Thanksgiving, and we have to be with family, and we have to eat. But I would just say, we know what works. Keeping the windows open works, wearing your mask as much as possible works, paying extra careful to the compromised and the sick works, and limit the length of your gathering, and limit the size of your gathering.
Governor, has there been an example in the entire crisis here of a private homeowner who has been fined by, whether it's the COVID task force or anyone else, not a business, but a single homeowner for a violation of 15 or more, any of the other?
I don't know. We don't know, but I will get back to you.
Governor,
but I'll tell you this, and a special note to parents, parents of teenagers, parents of young adults or whatever. If you allow your kids to have a party, and the party's more than 15, and we find out about it, we're going to fine you. And how much you're fined will be, like all things, at the discretion of the officer there. But you could be fined $500 for every kid in your house above the 15. So it's pretty expensive, and because of where we are right now, we're going to start cracking down.
Governor, on the asymptomatic testing, we're still hearing from some people, 18 to 39-year-olds, who say it's still not as easy as just going to sign up. It may kick back that you need to pay, and it's not free. Is it as easy as you make it sound to go get a test, and then?
It is, but we'll keep looking into it. So what we are doing, I'm asking Rhode Island to do a lot. What we are doing right now, today, tomorrow, next week, is making it easier to get a test. Next week I'll have more details, bringing more testing sites online, just making it easier and free so everyone can go in and out. We might start doing maybe, possibly, more like stop and shop locations, more in the community. So it's pretty easy now. Give me a few more days and we're going to make it even easier.
Just some people have suggested, because you're testing so many more asymptomatic people, college kids, a lot more mass testing, that you should separate the statistics for asymptomatic versus symptomatic people. What do you think about that, to give people a better idea of, is it just sick people who are testing positive, or a lot of asymptomatic people?
It's both. We look at the data both ways. Because we're doing so much testing on college campuses, literally thousands of young people, all of URI, all of PC, all of Johnson & Wales, that's true. Right? That is definitely true. It's mixed in the data and it skews the data. We look at it, we slice it and dice it every which way. We'd be happy to get it to you in a disaggregated fashion, but the bottom line is it doesn't change. Like, no matter how you slice it, test positive is going up, it's too high, case is too high, and hospitalizations. That's the thing. That's the lagging indicator. Hospitalizations have doubled in a few weeks. That's a problem.
I have family members who work in schools, and they said that some teachers were denied tests because they weren't showing any symptoms. Will this testing include those teachers? Okay.
Yes, that shouldn't happen. I'm sorry, and try again, and it won't happen.
Any outbreaks at Twin River? We hear from a lot of the workers at Twin River.
Can I get back to you for sure
Yes.
on that? I think no, but let me be certain and get back to you. We'll do it today. I'm sorry. Go ahead.
Governor, you keep comparing our situation in Rhode Island to that of Wisconsin, but Wisconsin also has a unique problem that the governor of Wisconsin has been in a continual tug of war with the state Supreme Court, which keeps invalidating the governor's emergency orders. Back in May, the Supreme Court of Wisconsin said that the governor's stay-at-home order was not valid. And I think as of a couple of weeks ago, the state Supreme Court of Wisconsin invalidated another series of orders from the governor, including, I believe, mask wearing. And so that's admittedly a unique case, and the numbers from Wisconsin are scary. Do you feel that there's any kind of pushback in Rhode Island comparable to that? Obviously not from the state Supreme Court, but it was pointed out to me yesterday that, say, the Facebook Live comments from the public during these conferences, which I don't see because I'm paying attention to you, are indicating a great deal of public dissatisfaction and frustration. And obviously, there's no probability of the Rhode Island Supreme Court doing what the Wisconsin Supreme Court did. But what are your concerns over the short term, next few weeks, and the longer term, next few months, and maybe even into next year, about how to maintain not only public compliance with these restrictions like mask wearing, like physical distancing, like hand washing, but more importantly, to maintain public support for those public health measures?
It's an excellent question. By the way, no analogy is perfect. We're not Wisconsin. In some ways, they're better off. In some ways, it's harder here because we are a much more densely populated state. You know, we tend to forget that. Rhode Island's one of the most densely populated states in America. I think we're number 2 behind New Jersey. That makes it tough to control this. Plus, we're connected, which is a beautiful thing normally about Rhode Island. We all know each other. It makes it really hard in this instance. Look, I worry about it. Just yesterday, I was in the conference, and a sitting member of the state legislature said to me they refuse to follow the law. That's a problem. And there's fatigue. There's no doubt about it. There's fatigue. We have been grinding this out for 7 months. The problem is it's a brutal reality, and if you don't follow the rules, bad things happen. More people go to the hospital, more people die, more people lose their jobs. So if I could figure out a way to keep everybody safe and out of the hospital and employed without requiring mask wearing, we would do it. But, you know, like the doctor said, the science is pretty clear. We know mask wearing works. We know social distancing works. We know outdoors and air circulation and open windows really work. So I do worry. People are frustrated. By the way, I am too. You know, my kids are bummed. They can't go to parties. We can't go see their grandma and grandpa in Michigan. Can't see my family as much as we'd like. But we just have to hang in there. We just have to hang in there a little bit longer because we have the antidote, and it's within our power whether we turn the corner or not.
What do you think are the public consequences then when, say, President Trump is infected with COVID and then tweets out, well, don't be afraid of it?
Yeah, I think that's terrible. I think there were real consequences to that. He also said, I almost died. So, you know, listen to whichever part of what he says that you like, but, I mean, leaders have to lead. By the way, it's not easy. I understand people are unhappy, but if we keep them safe and we keep them employed and we keep their kids in school, then I think that's the best we can do.
Amanda, last question.
Governor, you say we can't control small social gatherings, but you could bring down the gathering limit. Are you thinking of doing that below 15?
So we've thought about that, but no, because many of the events where we're seeing spread are already below 15. You know, many of these events are, you have your girlfriends over for book club, it's 7 people, everybody sits close, they share coffee cake, and no one wears a mask. So it's, yeah, I don't think that's it. So we're going to work on enforcement of the big events. That's what we're going to do. Events that are greater than 15 that we find out about, we're going to enforce the rules. Below 15, it's what Brian said yesterday. You know, you have mom over in the living room. We don't want to walk into your living room and disrupt that. Won't do that. So I'm asking Rhode Island to do the right thing.
Thank you.
Bye, guys. Thank you.